Speaker. Mr. Speaker, before I start, I want to say that there has been constant complaints about the garbage collection within the Killarney constituency. I don't know who's responsible for Killarney, but I would hope that the message get to that individual so they can remove our garbage in a timely manner, because it's causing lots of problem. Mr. Speaker, I rise on behalf of the Killarney constituency to offer my contribution to the Nurses and Midwives Bill. I decided as a young man that I would enter the medical field. It was not an easy joining. I was not born to wealth, nor was I born to privilege. I worked my way up over the years, and through the grace of God and hard work, I was fortunate to have a successful career in medicine. As an obstetrician, Mr. Speaker, I was able to help new life come into this world. It's one of my greatest pleasure to see my deliveries as grown men and women making their contribution to our country. And oftentimes, doctors get the most accolades for the good outcomes in healthcare. However, I can say without fear and without contradiction that nurses are the backbone of every healthcare system. And these dedicated professionals render care, organize hospitals and clinics, and save lives every day. Nurses, Mr. Speaker, are the heroes of the healthcare system. We saw this on full display during the pandemic as they cared for the sick and dying. Day after day, year after year, nurses make a difference to those in need. This Nurses and Midwives Bill provides for a comprehensive legal framework to address the evolution of nursing and midwifery in our Bahama land. It expands the practice of nursing and midwifery. It continues the Nursing Council. It provides for the training, regulation, and licensing of registered nurses, midwives, and advanced practice nurses. It provides for the training, regulation, enrollment, and licensing of practical nurses. It provides for the regulation of interns and unlicensed assistive personnel, and it also provides for the registration, regulation, and licensing of nursing agencies. The bill has innovations, such as the introduction of a new category of nurses to be known as the advanced nurse practice, or advanced practice nurse, which includes the midwife, the nurse anesthetist, the clinical nurse specialist, and the nurse practitioner. Of importance, Mr. Speaker, is the role of the nurse practitioner. The nurse practitioner is trained in the advanced assessment of the physical and psychological health illness status of individuals, families, or groups, and is competent to assess, diagnose, treat, and manage the care of a patient or client within the nurse practitioner's scope of practice, and in collaboration and consultation protocol and the prescriber's formulary for nurse practitioners, and order and interpret screening and diagnostic tests. The changes are in keeping with the innovative expanded roles of nurses. Mr. Deputy, wrong one, move that. Mr. Deputy, I support this bill and the effort to update the legislation governing nurses and midwives. However, Section 68 and 69, Mr. Deputy, I'm sure, can be interpreted as rustication, and that was not the intent of this bill, I am certain. And it would be my recommendation, since 68 and 69 are intertwined, that the bill be put in committee so that that can be corrected and the corrected legislation be brought forward. We must do all we can as legislators to improve the conditions of work for nurses and other medical support personnel. However, there are several competing crises affecting our healthcare system that requires even more than this bill. We have a well-documented shortage of nurses that is part of a wider global problem. According to the International Council of Nurses, due to the aging of the nursing workforce and the effects of the pandemic, up to 13 million nurses will be needed to fill the global nurse shortage gap in the future. There is aggressive international competition for nurses, and Bahamian nurses are especially desired in North America as they are well-trained and English-speaking. The government needs a long-term plan to ensure that we can train, recruit, hire, compensate, and retain sufficient nurses to ensure our healthcare system functions. Mr. Deputy, our country has been in crisis since Hurricane Dorian struck the northern Bahamas in September 2019. One crisis followed another. 6 months later, the pandemic began. The COVID-19 pandemic was an economic, a healthcare, and social crisis. At the worst of it, our tourism economy shut down. Tens of thousands of Bahamians were without work and food. On the healthcare side, wave after wave of the virus took our system to the brink of collapse. The full resources of healthcare system were required to provide for all the people who were sick at the various peaks of waves. As a medical doctor, Mr. Deputy, as a father, a grandfather, and as Prime Minister, my priorities were saving lives, providing food for our people, taking measures to boost our economy, and providing virtual learning for our school children. The mask and vaccines were secured, and other necessary measures saved perhaps thousands of Bahamian lives. Additional stress came to a healthcare system that was already in great need. The last major expansion of the Princess Margaret Hospital was the critical care block, which was launched during a previous FNM administration. And during my administration, we commenced work on upgrading the emergency care facilities at PMH. We also secured funding, Mr. Deputy, for another wing of PMH before we left office. Mr. Deputy, the monies were available for a new 4-story tower that was to be placed east of the critical care block. And, Mr. Deputy, this tower would have contained facilities for maternity, child health, and accident emergency, which were supposed to be placed on the ground floor of this tower. Mr. Deputy, this was a design-build tower, which meant that, and this was being done by the Beck Group, which meant, Mr. Deputy, that the tower would have been in its completion stage within the next 3 or 4 months. The problem at PMH and the Bahamian healthcare system are well known. It is the responsibility of each administration to do its part to improve the system. Sadly, we have a leader who is out of touch, usually out of town,
Bring on the boulders.
out of his depth, and out of ideas in most areas of public policy.
10 minutes of 5.
We have a leader
10 minutes
who
of 5.
prefers public relations and pandering instead of substance and actions.
Order, members.
Mr. Deputy, the nation was surprised the other day to see the Prime Minister expressing shock and surprise at the conditions at PMH. Our news reported the Prime Minister as saying last week, I quote, "What we see here is not challenges, but truly crisis." And he says he was moved by what he saw. That was last week. But here's what he said in 2021, Mr. Deputy. During a tour at PMH in September 2001, shortly after the PLP came to office, the Prime Minister said, quote, "It is accepted by all that the state of the hospital is dismal." Eyewitness News also reported the following under the headline, quote, "This is not acceptable." Prime Minister Davis tours PMH, says health care as number one priority for first 100 days, end quote. The report went on to say that the Prime Minister back in 2021 described his observations at the facility as bleak, with the healthcare system teetering over capacity due to being inundated with COVID-19 cases. He also said the healthcare system is a high priority. And the Prime Minister was quoted as saying, quote, "At the moment, the system is such that it has been overwhelmed by the COVID cases, and that has to be addressed first to see exactly what we will do, and it is accepted by all that the state of the hospital is dismal," end quote. Mr. Deputy said in 2021, we are in a health crisis and, of course, no doubt, an economic crisis. He also said, quote, "If it continues this way, the work would continue well into 2023, and we were saying that's not an acceptable time," end quote. Eyewitness News reported at the time, the Prime Minister added that he will discuss the matter further to see how they can speed up the process. So what did he do from 2021 to last week to improve the hospital and speed up the process because things were so dismal and bleak? It appears that it was mostly talk and public relations for our globe-trotting leader. If he knew in 2021 that PMH was in such a bad state, how could he last week again appear surprised that the same hospital and healthcare system is in a bad state? According to the Tribune in a story headlined, PM Hospital is in a crisis on January 30th, 2023. The Prime Minister said, quote, "We were hearing about it. We were seeing the news about it, but to come and walk and experience it is truly heart-wrenching. To see what we have today, but we will fix it. We are fixing it." We went on hence, "We trust that you will see what we're up against. And as an aside, I said, I see why you brought me, because you'll need money, but we will do what we have to do because I take a very, very serious view," end quote. With his heads in the cloud from constant traveling, the leader seems disconnected from the realities and needs of Bahamian people. It appears, Mr. Deputy, as if our leader is talking like royalty. We are hearing, quote, "We are hearing about it," as royalty speaks. We are seeing the news, language of royalty. And who is the we? The Prime Minister needs to come back to the Bahamian people and explain about this suffering. Prime Minister and his administration did not deliver after his tour when he first came to office. He saw the crisis in the hospital then and did nothing to fix it in his first 100 days. Again, Mr. Deputy, this shows the PLP is good on promising and bad at delivery. At STEMSO conference in Grand Bahama, 2014, Minister for Grand Bahama, now Minister of Health and member for Tall Pines, stated, my quote, Grand Bahama will have a new hospital by early 2017 with 150 beds, end quote. Words only, Grand Bahama has no such thing. Nearly a year and a half has passed, and the Prime Minister went on to tour the crisis again. Again, he seems surprised and is promising to fix it. I suspect the same thing will happen after the tour, after this tour, as happened after the first one. That is, Mr. Deputy, nothing, nada, nada. It is. That he is out of the country so often? Is it, Mr. Speaker, that he's out of the country so much that he has forgotten the crisis that he left behind and made worse by his inaction and indifference to the daily struggles of Bahamians? He likes to describe the problems, but has few to no solutions. We would not forget that at the beginning of this year, in January, in a speech at Bahamas Business Outlook, the Prime Minister listed his top priorities. He has a chaos in health, but his top priorities, as listed by the Prime Minister, was education, economy, and crime. So where are health and the immigration crisis in his priorities? His priorities are likely to change depending on the crisis of the day and the audience he is pandering to at the moment. In an editorial, Mr. Deputy, the Nassau Guardian described his remarks as, quote, a speech without a sound strategy. The paper noted, Davis appears to have forgotten that while he is seeking to hear a shared vision of what the next 50 years in the Bahamas looks like, his administration has presented no such vision. Davis presented no vision for what the Bahamas may look like in 50 years as birth rates fall, crime rates climb, and communities in our family islands are increasingly abandoned. But he charged others with formulating one. Wishful thinking and good intentions are no substitute for a sound strategy, end quote. Mr. Deputy, the Nassau Guardian January 29th editorial was titled, PM Outlandish Claim on Economy. It noted, it remains incredulous that Prime Minister Davis continues to maintain that he met the economy, Bahamian economy, in severe recession when he came to office in September 2021. Davis made the claim in his national address last October and repeatedly in the House of Assembly since his election. He most recently repeated it at the Bahamas Business Outlook last week. This claim is outlandish, it is false. No amount of repeating it will make it a fact. It went on to say, in fact, the economy grew by 14% in 2021, during which his administration was in office for only the last 3 months of the year. Following the worst period of the pandemic, the Bahamas, like all other tourism destinations, is benefiting from inflows of visitors, reflecting 2 years of pent-up demand when travel was severely restricted. Rather than serving as a catalyst to post-pandemic resurging economy, the Davis administration is benefiting handsomely from a number of projects left underway by the former administration. The editorial listed a number of projects launched by the FNM and my administration. Mr. Deputy, because of his indifference and the inaction, this New Day Gone Again PLP leader has made things worse since coming to office. Crime is worse because of inaction. The immigration crisis is worse. Real property tax has tripled. Inner city tax-free zone, government trying to usurp the law and tax the individuals within the inner city. Government proposing to take rent from tenants to meet demands of landowners' real property tax. Mortgages has gone up because of additional real property tax, thus delaying mortgages. The cost of living crisis is worse, with much higher BPL bills and VAT on bread basket items and medicine. The brave Davis inflation on top of the world inflation has made Bahamians very, very stressful. PMH and our healthcare system is in worse shape because of the PLP. The roads are worse. The roads are worse. In a matter of months, Mr. Deputy, I want you to listen. In a matter of months, we will have the Carifta Games in April and the Bahama Games in July. Yet, the stadium has been declared as unsafe. And an assessment done in April of 2021 suggested that the stadium, to be made safe, needed anywhere from $25 to $32 million expenditure. But yet, individuals will be placed in such a facility in April and June. Should a disaster occur, Mr. Deputy, can we deal with it? But we had plans to repair before moving forward.
Too much of your time. Too much of your time.
The Prime Minister is good at only one thing, and that is travel and taxation. Taxation. Instead of addressing the many crises at home, he likes to pretend as a big man on the world stage. I saw he is just back from good trip in Argentina. And we knew there are plenty, as we know, Mrs. Deputy, that travel for 2023 is just getting started. There are plenty more frequent flyer miles the Prime Minister will rack up as murder count increases, the PMH remains in a dire state, and more migrants rush to our shores. He will not seriously address the crisis at PMH. Prime Minister will not come up with a policy to fix our chronic nursing shortages. He does not spend enough time at his desk working to solve the problems facing our nation. That's why he keeps touring same places with the same problems, saying the same things, and not delivering any results. Mr. Deputy, the crime crisis in New Providence is a significant contributor to the healthcare problems we face. The shootings, stabbings, and other assaults have to be dealt with at the hospital. These violent incidents stress the emergency rooms and wards. In discussing last year's crime statistics with the media last week, the police commissioner revealed disturbing data. There were 128 murders, which is one of the highest such totals in our history. Armed robberies were up 34% last year. Robberies and shop breakings were up also. The opposition has asked over and over, what is the Prime Minister's plan to deal with crime? All we ever hear from the Prime Minister are slick words and empty pledges. And all that happens on the streets of New Providence is more violence, more crime, and more chaos. When the hospital is filled with victims of violence, that makes it difficult for doctors and nurses to get to other patients with emergencies. The Bahamas needs better leadership than it is getting from our leader today. Mr. Deputy, just as the crime crisis contributes to the health healthcare crisis. Similarly, the immigration crisis affects our healthcare system. Sadly, Haiti is in a state of collapse. The assassination of their president made a bad situation worse. Haitians are fleeing their homeland in tens of thousands. Migrants are getting on crammed boats and that are unseaworthy, risking their lives. They prefer to take the risk rather than living in the state of anarchy in Haiti. We already have a serious problem with undocumented Haitians in the Bahamas. They are significant users of our limited public health care resources. I fear a massive influx of Haitians due to Haiti collapse could make our existing health care problems much worse and, in fact, collapse. We need the Prime Minister to do all he can to ensure Defense Force and Department of Immigration have the resources they need to find and return to their homelands all who reside illegally in the Bahamas. And if Bahamians want to reserve their homeland, they must abide by the law and stop hiring individuals. The visa problem from Haiti must be investigated, as we had previously stopped issuing visa because of corruption and mishandling. The shanty towns must be stopped, as these pose great threats to our water table and our healthcare system, with the possibility of introducing cholera, which would be devastating not only to our healthcare system, but to our tourism product. I applaud the Prime Minister for saying he will ask the Attorney General to pursue a strategy to alter or vary the court injunction imposed on the shantytown removal policy initiated by my administration. The Prime Minister should follow through on the policy we pursued to clear and remove illegal shantytown in our country. The Bahamian people elected us to protect and preserve the Bahamas for Bahamians. We cannot allow the Bahamas to be overrun by outsiders. We cannot get to a place, for example, where our hospitals and clinics are filled even more with undocumented migrants, and Bahamians have to wait on lines outside to access the resources of their own state. Mr. Deputy, there's much work for this Prime Minister to do to address the serious problems facing our country. Thus far, he's failing, and failing miserably. The only thing this Prime Minister excels at is traveling. He's wasting taxpayers' money and time on many of these conferences. He needs to settle down, Mr. Deputy, get serious, and get to work doing the job Bahamians elected him to do. Mr. Deputy, in supporting this legislation, I urge the Prime Minister, for the sake of Bahamian people, to get serious about addressing our many national crises. The country needs substance and action, and not just public relations and pandering from our frequent flyer. Mr. Deputy, such a problem would not have existed if they had followed the plans that were left in place. The tower that was built, that was supposed to be east of the existing critical care block, would have resolved our problem in that we would have had a new emergency room on the ground floor and maternal and child health care centers for our babies and our mothers on the upper third and fourth floor. And the monies were available, and it was a design build, would have been completed within the next 2 to 3 weeks. The problems today would not have existed. Mr. Deputy, I support this legislation.
Thank you, Honorable Member. As many.